All right, well, welcome everybody to the Moving Maine Network's mobility learning community. We are excited to hear from Jennifer Battis today about some really interesting work that she did, an assessment and a report. And of course, it's very near and dear to the work that Moving Maine does, thinking about transportation access and how that affects people's health and their ability to access healthcare and all the things that help us to be healthy. So excited to have Jen here today. We will do a round of introductions. I will share a little bit of background and a couple updates, and then we'll turn it over to Jen. Think about questions you want to ask, because we'll have time for Q&A, and you can feel free during this while she's presenting, want to put your questions into the chat so that we capture them. And then we'll also have time towards the end for you to share updates or things that you're seeing, hearing, out in the world that you want to bring to our attention, to bring to this group's attention or get help on. Doesn't have to be like, something positive. It could be something you're concerned about that you want to bring to people's attention. So there will be a time for that. So we'll start off though with going around, and to avoid that gym class feeling, I'll call on people. So we'll go to Larry first, and then to Joe Cooper.
Hey, good morning, everyone. Larry Days from B-Soup Transit. I'm the mobility coordinator, and I'm excited for what we're going to share today.
Hi, I'm Joe Cooper. I'm the Transportation Equity Project Manager for Maine Council on Aging, and I too am very interested in this topic. Thank you.
Go to Erin, and then Jessica Sear.
Hi everyone, I'm Erin Bengalib. I'm the Senior Transportation Director at KBCAP. We cover Kennebec and Somerset counties.
Hi everyone, my name's Jessica Sear. I am a person with a disability. I'm a wheelchair user, and I am an advocate for people with disabilities. Thank you.
We'll go to Julie, and then to Joe.
Hi, everybody. I'm Julie. I work at Alpha One, which is Maine Center for Independent Living. So we work with individuals with disabilities or aging in place who live in the community. So providing resources and programs.
Everybody, I'm Joe Alva. I work with Grow Smart Maine. I work with Zoe on Moving Maine Network as well. Excited to be here. I have a big wrap, so I will probably be going off screen to deal with that. Okay.
We'll go to Alice, and then to Maggie, and then to Dwayne.
I'm Alice Gormley, and I work in population health management at the Maine Health Medical Group, and I help coordinate some programs around transportation for increased access to healthcare services.
Hi everyone, I'm Maggie. I work for Luneco Land Trust, which is based in northern Cumberland County in the Lake region, and I also sit on the Town of Bridgeton's Community Development Advisory Committee.
Hello, I'm Dwayne Scott, Chair of Augusta's Age Friendly Committee. That's what I do in my retirement. I retired from Maine DOT as the Director of Multimodal Planning.
Awesome. And then I don't know if you say Tamara or Tamara, you can tell us, and then we'll go to Sarah, and then to Ryan.
Hello, I'm Tamara.
Oh, okay.
Neither of those. Rhymes with Sarah, I guess. Tamara Herrick, I'm the Director of Healthy Aging at Maine Health. And I do a lot of work with older adults and mobility, from brain health to you name it. We cover it. So I'm curious to hear about the results from this assessment.
Hi, everybody. Sarah Cushman, she, her. I'm a transportation planning consultant. I'm also the faith representative to the Moving Maine Network Steering Committee. And probably like everyone on this call, I carry a real concern for our most vulnerable folks getting around, and generally that's in the world of walking, biking, taking the bus, using transit, and carpooling too. So great to be here. Always love the learning community.
Hey everyone, good afternoon. Sorry, I was off camera doing a little bit of multitasking, catching up on a few emails. I'm Ryan Neal. I'm the transit manager here at the Maine Department of Transportation.
Great. And then I see Vanessa doesn't want us to have to hear the Tai Chi class, although that could be interesting. And she's the senior program leader and bus driver in Portland. Like you drive the Metro bus? And she's answering in the oh, 14 passenger minibus. Awesome. Awesome. Good to know. You might get some calls that you okay, well, thank you all. So one thing I do like to do for these sessions is just share a little bit about the Moving Maine network. And so I'm gonna do that briefly. And I'm gonna see if I can share the correct screen. That's always a challenge, right? Let's see, I'm gonna swap and then okay. Here we go. Okay, so here we are. So we're all here today to talk about working towards equitable access to healthcare for people with disabilities, and excited to have Jennifer present about that. And we are back into the swing of doing these roughly monthly, I say, because we know then summer happens and we may decide to skip a month. Our topic that we're working on for next month is actually about walking or being a pedestrian in rural Maine. And so if you have thoughts on folks you'd like us to hear from on that topic, please let me know. Planning to have Tanya Rukowski, who's in Washington County, be one of our presenters. And I think, trying to kind of change this often thing that we hear that nobody wants to walk or nobody needs to walk in rural Maine, and that we all know is not true. So look forward to hearing more about that. So these sessions are core strategies, Moving Maine network. So first and foremost, we want to strengthen the network of all the folks who care about transportation access for people who can't drive and people who struggle to afford transportation. And every time we come together, it's an opportunity to build our relationships with one another, which we know leads to actions, solutions, problem solving, and is really powerful. And hopefully we have fun together. We also want to inform policy change, and I will talk a little bit about some of the good work that's happened this year that I think we're really excited about. We know there are effective policies out there, and so that's a big part of what we want to make happen for Maine. We support better coordination, so getting all the sectors and all the different organizations who are impacted and caring about this issue to have ways to coordinate with one another. We just put in a big dollar amount grant proposal to the Federal Transit Administration to advance coordination in Maine. And so just keep looking at ways to make mobility management programs happen in Maine. And so we won't find out about that, whether we get that until the summer, but keep your fingers crossed for us and send some positive vibes for us to get that funding for Maine. And then finally, to amplify mobility stories. And this is something that I think comes through over and over about how important it is for decision makers, for the public, to hear from people who are living the experience of having transportation barriers. And what that, what it looks like for the most impacted people. I think it's really evident that a lot of folks in decision-making roles are just very separated from what it's like to not drive, or to have affordability issues. And so we really want to have faces and names to the stories, and we'll be working on, we're about to launch a call for stories and do a story collection project. And so we'll be talking more about that next month. And I think that's one of the things that's really powerful about the work that Disability Rights Maine and Jen have done is that it's really hearing stories from people who it's their life, and it's not coming through, it's not getting like interpreted through a professional, but it's coming straight from people who are experiencing it. So our goals for these sessions are always to share expertise, and we define that very broadly. It's lived expertise. It is learned expertise. It's not, you don't have to be a, PhD to have something to share. So we want to hear what do you have to share, to move people to action on solutions and to build the relationships that we know create the foundation for that. I wanted to celebrate a little bit around our advocacy wins. So, we came together a little over almost 2 years ago and set out our policy priorities as Moving Maine. We ended up joining up with the Policy Action 2023 process, and so I wanted to celebrate some of those wins. Many of you were involved in, whether you came together to brainstorm, whether you testified, whether you cheered on others. Your role was really important. And so I wanted to celebrate some of our wins. And this is the point where I want to ask Joe to pause from his sandwich and throw into the chat that document that we wanted to share. So we'll provide links with more information. Oh, he already did it. He's just,
I'm on top of it. I'm here, but I'm just snacking. Yeah.
I don't even, we're like brainwaves connected there. So first, LD 1559, this bill focused on public transportation. And when we say public transit or public transportation, we're not just talking about urban areas. We're talking about every part of Maine. We have public transportation in Aroostook County. We have it in Washington County. We have it all across the state. We want it to be stronger. Our win with that bill, we didn't win as much as we wanted. We wanted money, more money. Didn't get as much as we wanted, but we did strengthen the Public Transit Advisory Council, and that's huge. And that council will now meet more often and have a chair and a vice chair who are they're not staff of DOT, and they can call for more meetings. So we're looking forward to seeing the work that the PTAC, as it's called, does over the next year, culminating in a report to the legislature, and looking for ways that we as advocates can support that. LD 1674 advances safe and complete streets. This bill is, I like to think of it as it's, we often are told that things are getting worked on and legislation isn't necessary. Well, that may be true, but there's nothing wrong with putting it into a bill to require a report to the legislature, which is part of what this bill did. And so DOT is now working on updating their speed setting policies, which makes a really big, has a really big impact on how it feels to be wheeling and walking around on our roads. And so we're monitoring that. And I think, pushing for a more complete streets, more of a Vision Zero approach to those, to Maine's policies. And then finally, LD 1673 is a resolve to study what we are calling a Thriving Corridors program. So that means, so, you know, our original bill was to create the program. It was turned into a resolve. So we're still making progress on that. And that's really about, you know, how do we make these places where there's these big, you know, what folks like to call stroads. They're too big. There's too many cars. They're going too fast in areas where people are shopping, you know, walking to services, riding their bikes to school. How do we make those better places? And that we need to do both land use, can't, like, probably not going to get the roads we want if we don't shift the way the land is used around them. And then the last thing is not the bill, but it's a very tangible outcome, is that we built relationships and power through the process. And so we, you know, there were, you know, Maine DOT staff showing up week after week to be part of our conversations, and really did some great and important relationship building there. And we also got in front of the legislature to put a face to the people who need these changes. And so thanks to everybody who testified. It was really valuable to be able to bring stories when I testified on behalf of Moving Maine, and I know Sarah Cushman did as well, to be able to talk about the stories of the real people who care about this. So wanted to share that as we close out, where this session is, I mean, it's still going, there's still really important stuff happening, but our bills have come through the other side. And that fact sheet that Joe threw in the chat is a good place if you want to click on links and see language of bills. So I'm going to stop sharing. And I'm going to, so Jen, I believe that you have access to screen share.
Okay.
And I'm going to actually let you introduce yourself, because I lost track of where I put your bio, but I'm sorry about that. But you can tell us all about who you are and how you came into your role and came to do the assessment. So I'll turn it over to you.
Okay. Hold on. Here we go. Okay. My name is Jen Battis. I'm the Health Equity Project Coordinator at Disability Rights Maine. I come from a background of doing program evaluation and research. And when I guess I can just go to the next slide, because I'll tell you how I came to be connected and working with Disability Rights Maine. Because it was pretty much directly related to this project that I'm going to be telling you about. So since DRM has started, Disability Rights Maine is Maine's protection and advocacy agency. Each state is required to have one. And we do a lot of legal and advocacy work for people with disabilities who are experiencing like barriers to school, education, employment, discrimination, all of that kind of stuff. And so through their work, always they've had a number of cases that were healthcare related, but with COVID-19, that definitely, you know, came to the forefront, really showed where a lot of the inequities are. For example, not prioritizing people with disabilities for in the vaccine distribution, and that has something to do with the lack of data that is available. And so we realize, okay, we need to do something about this and have that data to show what's going on. So internally, DRM formed a health equity team to start looking at the cases that were coming in that were related to healthcare issues, access, quality of care, that sort of thing, choice in care. And then in 2022, DRM got a grant from the Maine Health Maine Health Advocacy Foundation, Access Foundation. Wow, sorry, I should know that. MHAF, to do this project. So there's not a ton, but a decent amount of research out there that's from a provider perspective about what are the barriers to accessing healthcare? Where are the training needs on accessing healthcare for people with disabilities? That's fine, but what about the numbers from people themselves, like their stories, their like what it's looking like. So often what DRM was doing, you could it's working with a single person and advocating and working for them to have the access that they need. And so it would be easy for a hospital system or whoever to say, like, well, we fixed it for them, and not thinking about the bigger picture. So that was kind of the purpose of this report, is to say, no, it's not just that one person. And in fact, it's a huge problem across the state for pretty much everyone. Well, not pretty much everyone. So to do this, we worked with John Snow Inc., who is a public health consulting firm, to put together a research study. So I should go back. That's where I came into DRM, was to be sort of the facilitator of this project and coordinate everything. Since then, my job has sort of transitioned to taking this stuff, taking the recommendations and the findings and doing something about it. But it started with this project, where we did want to get as much information out there as we could. So we did a survey, some focus groups, a literature review, just to see what was out there. Secondary data, which is like data from the CDC or census data, of which there really is not much that you can break down by disability status. And then there were a few groups of people, perspectives that we wanted that we weren't able to get through the focus groups. For example, immigrants coming to Maine. And so we did some interviews with people who are working and providing services to those communities, part of those communities, to get those perspectives in there as well. So I do quickly just want to go over, I think it's important to note how this was truly a statewide project. It was really our goal to make sure that it was not just Portland focused or Southern Maine focused, but it was everywhere. So the survey that we had, it was like all hands on deck to get it out there. We had over 600 responses, which is incredible. And it does make sense that Cumberland, so red, the darker red is the most, where the most highest number of responses were, and the darker green is the least. And so Cumberland counties, that made sense that there were a lot of responses there, but the second highest county that we got responses from this survey was Aroostook, which is just amazing. And then the focus groups, we did 11 focus groups. We sort of organized them by like disability type. Anyone could come to any of them, but that kind of gave us a starting point for what sort of accommodations someone might need, and then go from there after that. So I think 2 or 3 of them were in person, and the rest were, I think 8 were online. So that also helped us get people from all over the state. Again, I think the second highest county that we got responses from was Aroostook. And so for the survey, we had responses from every single county. The focus groups, we just were missing, Knox and Hancock. So again, good representation across the state. This is a little bit more of the demographics. So we did only ask demographic questions in the survey. So we don't have like average age, what type of insurance you have from the focus groups. But again, it was pretty representative of everyone living in Maine. We had a wide variety of different types of disabilities. We had every age group from 18 all the way to 90. Most of, or over half of our survey respondents had an annual income of less than $20,000 a year, but there were also respondents who were making over $100,000 a year. And then again, most people had Maine Care as their insurance, but it was also a variety there too. 2% of the people who responded to the survey didn't have any insurance at all. So I will drop in the chat once I'm finished the link to our full report. I have the full report, a plain language issue brief, and then, a summary, and then 5 different issue briefs that cover each of these sort of 5 areas. When I say priority area, it's not that that's the top, like one is the top priority. It just was kind of the overarching themes where things were tending to fall into these sort of buckets of topics, I guess. And so we just kind of structured them in the way that you might go through the healthcare system. So like first, there's, I don't know, data. I don't know if that's first or not, but it's kind of off on its own thing. Like first you want your provider to be educated. Then you need to be able to get to the appointment. Communication is sort of, throughout, setting up, in the appointment, after the appointment. And then once you are in the parking lot, or in the building, you need to be able to access the space. So that's kind of the 5 main areas that we were looking at. So today I want to just talk quickly about 2 of them that I think maybe most apply to probably some of the work that you're doing. Communication, and then the structural and systemic barriers to care, which includes transportation. So communication was a huge issue across the board, and what that looked like might be different for people depending on what their disability is or where they're living. But in our survey, almost half of people said that they had it was difficult to communicate with their healthcare providers. And I should also go back and say, when we were saying this, we meant healthcare in the broadest sense of the word. So dental care, physical therapy, emergency room, primary care, all of that. And then 20% said that their healthcare providers don't listen to their concerns. They don't explain diagnoses or conditions. They don't answer questions. They don't involve them in providing options and like, what would you prefer in making decisions in their own care. In the focus groups, this came up in every single focus group. And a lot of it came back to not just healthcare providers, because a lot of the issues also come from like the front desk staff and receptions and getting even to like before you even talk to a provider. A lack of education on like the different ways that we might want to communicate, the different technology that people use, different accommodations. It also has to do with that like 15-minute time period for appointments where everything is rushed. You just like, they got to get on to the next one. And then also there were a lot of issues with deaf and hard of hearing ASL signers who were not provided interpretation services, or they were provided the virtual interpretation when it really was better to have had an in-person interpreter. So here's just a couple of quotes that I wanted to share. Throughout our report, we made sure that we had quotes from the survey responses, from the focus groups, to really, I think it's much more meaningful than me saying 44% of people to really tie it to real people. So I won't go over the recommendations just in the interest of time, because I'm going to talk about more like how you can apply this to your work at the end. So in the structural and systemic barriers to care, some of the key findings we found were that over 50% of people who, again, this is from the survey, who said they needed care, there was a time they needed care, but they could not get health care in the past 5 years. And definitely, COVID was in there for a good chunk of that 5-year time, but the 5 years, this was in 2022. So yeah, so it went before COVID. Another huge issue that came up was the way our healthcare system is set up and how, you need a referral to go see this place, and you need to go, to one town to see your dentist, to another town to go to your primary care provider. Maybe you got to go to Boston for your specialist. So the way it's all separate can be really hard to navigate, particularly if you're having, all these insurance stuff on top of it, where the insurance is being like, no, we're not approving this, and you have to go through this whole thing. But also, when your provider says they'll make a referral to a specialist and then nothing happens, that's creating delays in care too, and then it sort of comes back on you to have to make sure that that's moving forward. And then I don't think I even need to say this one to everyone in this room, but public transportation does not exist, or it's very limited, or it's not even accessible if it does exist across the state. So again, insurance doesn't cover a lot. I've had glasses for a long time, and it's so hard to find a place that will take Maine Care for doing actual vision tests. The barriers to, we gotta, I think, burn down insurance, start over. But people on Maine Care definitely had more barriers to trying to access care because of providers saying, we don't accept Maine Care, that sort of thing. And one of our focus group participants said, if you do not drive, you're unable to access healthcare. So some of this definitely ties into what you're doing, where it's like increasing opportunities to funding, resources, technical assistance to support that growth of how do we create like peer support positions to help people navigate the health system, or how do we build stronger transportation networks? How do we make sure that communication between one provider to a specialist or to another is happening in a efficient and timely manner, so that you're not sitting there waiting around or having to follow up and things are just getting delayed. So like I said, this report, we finished it, we released it last June. And so I did want to quickly go over just a few things that we've been doing since, so that you can have some ideas of where we've gone. And if you have ideas and you want to talk more, please let me know, because this is just, a little bit, but there's so much work that needs to be done that I am totally into talking to anyone about whatever is on your mind related to this. So I'm working with a medical student in the Tufts Maine Track program about looking more at disability in their, incorporating it more into their curriculum, working towards just generally diversifying the standardized patients that they're working with. The Children's Oral Health Network of Maine learned about this project and said, oh, we don't have any oral health data around children with disabilities. And so how do we make sure that the work we're doing and what we're advocating for works for everyone, not just some of the children here in Maine? And then another piece too is we're working on that data piece to try and move something forward, whether it's legislation or something else. What that looks like, we're still kind of working on it, to have disability status or disability be considered a demographic question in data, so that we can see what's working, identify the gaps, and just have more information there to be able to compare across different projects and programs. So that's another thing. So what can you do? So some of this stuff definitely is not necessarily related to healthcare, but could be like it's showing up in healthcare in our report, but it is happening everywhere. So number one, definitely be considering and ensuring that you have people with disabilities as part of your advisory committees or your planning groups or whoever is developing policies, procedures for your organization or, you know, your committee, whatever that is. And then also think about accessibility on your website or the materials that you're handing out at events or social media posts. So for example, this is just a limited number of ideas, but do you have image descriptions on all of your social media posts? Alt text is great, but that's read by a screen reader. And so if someone is deaf and blind, that's not going to work. And so the image descriptions will kind of cover everything. Do your videos that you're posting have captions on them? Real captions, not auto captions. I don't know if you've ever watched things with auto captions. Try it out. It's not good. Telephone systems are a huge barrier too, you know, with push 1 to talk to whoever, push 2 to talk to the dentist, you know, whatever. Those can be really a struggle and a barrier for people who are using calling through video phones with interpreters. And if you need a minute to sometimes with like mobility issues or like a brain injury, you might just need a minute and it kind of rushes you along. So think about the accessibility in those sorts of telephone systems. If you have forms for something that you're doing, make sure that someone could fill them out in advance. And that might mean through their computer using a screen reader. It might mean doing it on paper by hand and not just requiring someone to do it when they come in. And then also any sort of forms, websites, portals that you have, are they able to be used by someone who's using a screen reader? Because a lot of them aren't, and it's not really thought of again until it happens and someone brings it to your attention. So those are kind of a few things that regardless of the work you're doing, you can be thinking about that really tie into some of these larger healthcare barriers. And if we start in just our general, whatever we're doing, working on, thinking about this stuff, it will help us get a little further along in the healthcare piece too, because it'll just become normal and like what we do. So yeah, that was it. Any questions? I know I kind of went through that at 60 miles an hour.
Well, I'll just jump in. This is Zoe and just say thank you. And yeah, my brain was my wheels were turning in a lot of ways, and I'm sure that was happening for other folks. And I love that piece about us all taking responsibility for being inclusive. And how do we make that normal? How do we get, how do we, and we actually, I'm just realizing we had been for these meetings, we used Maine Relay, and we generally ask like when people register would, are accommodations of any kind needed? And then I'm just realizing we should always have the captioning so that it's always on. The real person captioning is on our recording. So that's a good reminder for us who are like what I have found is like it's like layers of thinking about it that and what I think is so important is like keeping an open dialogue about feedback, because you might be conscious of like even if you're somebody who's thinking about it a lot, you're still going to miss a bunch of things, right? So having it be constantly open, that you're inviting, you're asking people, how did it go for you? What did we miss? What did we not think of? I'll say personally, I've learned so much from, just always like having it be open and every day. So, yeah, I would just love to hear if there are questions, thoughts from folks in the group. And folks can feel free to just come off mute and share unless things get unruly, and then I might call on people, but who's got something they want to ask or share?
I think that this was really good. I think that there almost should be an automatic standard that organizations or volunteer groups that are working with people and who claim to be working with people, advocating for people with disability, living with disabilities, have some kind of even just for their website, just some standard that they get checked on. Because I think sometimes organizations that make that claim can just be as forget completely that if somebody has a hearing loss or low vision, just those things can be such a challenge with their website. So I would wonder if there isn't a way that we could make some kind of a standard available for that kind of thing.
Yeah.
I would
Oh.
echo that comment, Joe, in that I just made a note and took a picture of the slide to try to create a checklist to review our own site and our forms. And it would be nice to have a standard that kind of made it real easy to check that. So I'm going to try to create that. The question I had was, I love all of this idea. I wonder how much the problem is exacerbated by a lack of healthcare services themselves across the state and the inequity there. So access is a problem, but having a destination available is also, it seems to me, a huge problem.
Yeah, and that definitely came up in the survey and the focus groups where, especially for things like specialists, and dental care, depending on where you live, I think someone said there's one dentist in Piscataquis County, and that's it. It's a pretty huge county. And so if you don't live close by to where they are, that's going to cause barriers to even get there. And if they don't take Maine Care and you have Maine Care for your insurance, then what do you do? And so a lot of people talked about like the wait list that they have to wait to see someone for, like, my doctor wants me to see this specialist and it seems urgent to me, but I have to wait a year to see them. So how does that make sense? So, and then having to travel to get like to Boston maybe to see someone, and that you have the transportation stuff, but you've also got like, do you have the ability to take time off of work? Do you have someone to watch your children? All of these other barriers that come up alongside all of that. So yeah, there's a lot of work that needs to be done. Just kind of fill in that need for providers.
And also along those same lines as that, if somebody is dissatisfied and knows they can advocate to change providers, but there's nobody available taking, new patients. So they're almost like, it's better the devil I know, like I might as well just stick it out, which nobody should have to do either. But yeah, even just those lack of primary care providers is prevalent everywhere.
I'm just curious in terms of in the world of websites, I know there are standards and I couldn't tell you what I forget the name of the the standard, but I don't know if that's something that somebody else knows and could drop in the chat. And I think with so many things around disability, around ADA, that the compliance is based on, you know, we have to complain about things if they aren't, you know, there isn't a whole lot of teeth in how we ensure that people are doing it. But so I guess as like a companion, it's a question out of that is, I do wonder sometimes why we don't have more lawsuits, and if that came up in conversations about, like, since our ADA and, you know, our civil rights laws require complaints to then take, you know, to get us somewhere, like, I don't know. I know nobody wants to be the one to say like lawsuits, let's do more of them. But I mean, I do think, like, should we be like getting more litigious to make progress on this stuff?
Yeah, and I mean, I think what Julia was saying is part of it, where if this is the one provider that I can see, do I want to really, you know, go down this, like, burn this bridge? Also, I think a lot about, do people know what their rights are, that they can make a complaint, that there are organizations out there that can support them in that. I know, for example, my husband is deaf, and early COVID, his primary care provider did not want to do a like a Zoom call or any. I understand that's not HIPAA compliant, maybe, but they were not willing to do it. And so it ended up being me listening to the phone call, repeating what the doctor was saying while he was having vertigo, and the doctor, and he's lip reading me and trying to respond back. And we walked away from that being like, this isn't okay. But at the time, I mean, it's funny now working at DRM where I'm like, oh, this is who we should have called. But if you're not connected to other people who might know that, like, oh, this happened, like, if you're not part of a support group or a network or with connected to other people who know and maybe have been through that before, what do you do? I don't know. So I keep thinking a lot too about, like, how do we, it's kind of feels like an impossible problem, but like, how do we get the word out that you have rights to the people that we aren't currently, how do we find the people that we're not currently reaching? So yeah.
So I just want to note, so we are, this is great. I'm loving this. And I could probably just like forget what time it is and be like, it's like 2:00. So I just wanted to open it up at this time. If anybody has an update that they want to share or an issue they wanted to bring to folks' attention, to feel free to also, you know, so we can keep asking Jen questions or making comments, but then also to add in if people have things they want to mention.
So I have I really like the idea of the review checklist from the Joes. That's really something that, you know, you look at your website all day long and, you know, some particular age groups, you know, you look at it and you see a lot of stuff, it doesn't make a lot of sense. And if you are going to work on that, I would love to get that checklist, or if somebody has that kind of an eye that can look at our website, bsouptransit.org, and say, hey, maybe you're excluding this community, or maybe you're missing the boat on, you know, how our information is shared. A lot of people tell us it's good, but, you know, a lot of people say a lot of things. So if we could collectively as a group share that list and maybe look at each other's and try to get like a third or a fourth eye on it and see if we can't all improve collectively.
Just a plug too, I don't know, it probably won't solve all of the things that we're talking about since it's a very detailed situation, but just today at 1:00, not that people are going to go, but just so you're aware, Maine site has a lot of webinars on creating accessible content. And even today, they're having one on discussing the principles of creating accessible content for print, digital, video, audio, and social media. And literally, like, the first, you know, sentence says, beyond the possible legal requirements, like, there's a lot of important reasons. So those are free and you can rewatch them after they're done. So I know that and they're always open to like new things. So if there's like more of a specific niche of like something we're looking for, you can always reach out to them and ask if they put something together. So just kind of coincidental, it's happening like in 7 minutes.
That's amazing. Yeah, actually, and that would be a great one for us to follow up on, and maybe having our own learning community focused on this, like at the, you know, the intersection of transportation. I was really struck, Molly also from Disability Rights Maine mentioned at one of our advocacy meetings that folks who have aphasia or other speech challenges not being able to get through to schedule their ride with Maine Care, with Motive Care. I was just like, whoa, that is just like burned into my brain. And I mean, there is a conversation going on about that. And I guess I would just give a plug that if folks want to be part of the policy and advocacy work that Moving Maine is doing, like, come on over, like you're all welcome to be part of that.
One other transportation related thing that you just made me remember that makes sense in hindsight, but kind of surprised us in the moment was in our focus group with participants who are blind or low vision. They said a lot about, you know, I'm jealous of the people with Maine Care who can access transportation where, you know, if they don't have Maine Care because they have private insurance, then they're relying on friends or taxis or whoever. And so knowing all the problems about the Maine Care transportation and then hearing people be like, wow, it's I wish I had that, regardless of the problems, it's so better than my situation. It was just like, oh, yeah, that's a great point, and not what we expected to hear.
Yeah, a lot.
I was just gonna add, the Affordable Care Act was supposed to expand transportation under private insurance, and a lot of people haven't been paying attention to that, so I'm not sure the insurance providers have been doing it, even though they're mandated to do so. So that might be a role for DRM and other entities to push a little harder on the private insurance companies, because that I had to write my master's thesis on the ACA, and I am certain there is language in there. And I am also certain that these private corporations will do everything they have to do to not do that. But sometimes a little bit of pressure goes a long way to open up access to, at least, even if it's just one person at a time. That's still better than nothing.
Yeah, thanks. I will definitely look into that.
Yeah, this is all really great too, because as we look towards the next legislative session in Maine, we'll be updating, sorry, I have a very anxious cat that we'll be updating our policy priorities as Moving Maine. And so this is all like some really good food for thought around that. Anyone who hasn't had a chance to weigh in?
I would just say I dropped a link in the chat for DREDF, the Disabilities Rights and Education Fund. If you guys are not aware of them, you should make yourself aware of them. They are an incredible organization. For those of us in transportation or that work with people who are trying to access transportation, they wrote the topic guides on the ADA. So they took that 2,000-page section of the ADA transportation and turned it into a very easily digestible bullet point, like 15-page thing. I rely very heavily on it, especially when I'm training on ADA compliance, and it's an incredible tool for the consumers to understand their rights. Not just that they have the right to an accessible trip, but also what's a reasonable length of time to be stuck on a phone call. All of those really important things that we have to report in our metrics that the average person doesn't understand. And like I said, it's very easily digestible. So if you were to do DREDF and then just do topic guides, ADA topic guides, it will open up a world of knowledge for you that you probably and a level of detail that you probably haven't seen yet. So please check that out. And also they do a ton of pro bono stuff too. So if you ever do need help with things, you can just email them. They're based out of Oakland in California. But they're an incredible group of humans, very similar to DRM. So definitely reach out and get connected. And when you have these types of questions, they'll be able to answer them for you.
Awesome. Thank you. Thank you for that. And thank you everyone for the great resources. We actually are very, very close to launching our new website. And one of the things I'm excited about is for each of our learning communities, there'll be a little section with links to the cool stuff that was shared and kind of the top takeaways. But in the meantime, we'll probably just get an email out to folks with those links. Thank you so much, Jen, for taking the time. This was really great. And we look forward to supporting Disability Rights Maine's efforts. And, I know we'll be talking more. So thanks all. Have a great day, and we'll talk to you again soon.
Thanks, everybody.
Thank you.